Hi everybody, as you can see on the video thumbnail, this is a lady who has excessive hair growth on her face. Initially you might think that this is not a lady, this is a man, but actually this is a lady who has excessive hair growth on her face, and this is really embarrassing. Today I am going to discuss the disease which causes this problem, and that is known as polycystic ovarian syndrome. This polycystic ovarian syndrome is a hormonal disorder common among women of reproductive age. Women with polycystic ovary syndrome may have infrequent or prolonged menstrual periods or excessive male hormone androgen level. That's why this lady is showing excessive hair growth on the video thumbnail. Okay. The ovaries may develop numerous small collections of fluid which are known as follicles, and fail to regularly release eggs. The exact cause of PCOS is unknown. PCOS is the abbreviation for polycystic ovary syndrome. Okay, as I mentioned, exact cause of PCOS is unknown. Early diagnosis and treatment along with weight loss may reduce the risk of long-term complications such as type 2 diabetes and heart disease. Now let me tell you the symptoms. Signs and symptoms of polycystic ovarian syndrome often develop around the time of the first menstrual period during puberty. Sometimes polycystic ovary syndrome develops later, for example, in response to substantial weight gain. Signs and symptoms of polycystic ovary syndrome vary. A diagnosis of PCOS is made when you experience at least two of these signs. So I am going to tell you very important signs, and if there are two signs out of these three, then there is the certainty of the diagnosis of PCOS. Okay, the first sign or feature is irregular periods. Infrequent, irregular or prolonged menstrual cycles are the most common signs of PCOS. For example, you might have fewer than 9 periods a year, more than 35 days between periods, and abnormally heavy periods. Then the second feature of this illness is that excessive androgen, that's a male hormone. Elevated levels of this male hormone may result in physical signs such as excessive facial and body hair that is known as hirsutism. So this as you can see on the video thumbnail. Okay, and occasionally severe acne and male pattern baldness can also be seen. The third feature is polycystic ovaries. Your ovaries might be enlarged, and certain follicles that surround the eggs. As a result, the ovaries might fail to function regularly. PCOS signs and symptoms are typically more severe if you are obese. You should see your doctor if you have concern about your menstrual period, if you are experiencing infertility, or if you have signs of excessive androgen such as worsening hirsutism, acne, and male pattern baldness. Okay. Now let me tell you the causes. The exact cause of PCOS is not known. Factors that might play a role include excess insulin. Insulin is the hormone produced in the pancreas that allows cells to use sugar, which is your body's primary energy supply. If your cells become resistant to the action of insulin, then your blood sugar levels can rise and your body might produce more insulin. Excess insulin might increase androgen production, causing difficulty with ovulation. The second factor is low-grade inflammation. This term is used to describe white blood cell production of substances to fight infection. Research has shown that women with PCOS have a type of low-grade inflammation that stimulates polycystic ovaries to produce androgen, which can lead to heart and blood vessel problems. Third factor is hereditary. Research suggests that certain genes might be linked to polycystic ovary syndrome. Fourth factor is excess androgen. As I told you before, the ovaries produce abnormally high levels of androgen, resulting in hirsutism and acne. Now let me tell you the complications. These complications include infertility, gestational diabetes or pregnancy-induced high blood pressure, miscarriage or premature birth, non-alcoholic steatohepatitis, which is a severe liver inflammation caused by fat accumulation in the liver. Metabolic syndrome is another complication, which is a cluster of conditions including high blood pressure, high blood sugar, and abnormally high cholesterol or triglyceride levels that significantly increase your risk of cardiovascular disease. Another complication is type 2 diabetes or pre-diabetes. Sleep apnea is another complication. Depression, anxiety, and eating disorders are also associated with this. Then you may also get a complication of abnormal uterine bleeding. as I have posted videos about dysmenorrhea and menorrhagia, so which are also signs of this polycystic ovary syndrome. So you can see those videos. Cancer of the uterine lining and endometrial cancer can also be a complication. Obesity is associated with PCOS and can worsen complication of the disorder. So these were the complications. Now let me tell you how we diagnose polycystic ovary syndrome. There is no test to definitely diagnose PCOS. Your doctor is likely to start with the discussion of your medical history, including your menstrual periods and weight changes. A physical exam will include checking for signs of excessive hair growth, insulin resistance, and acne. We may also recommend a pelvic exam. In this, we visually and manually inspect your reproductive organs for masses, growths, or other abnormalities. Blood test. Your blood may be analyzed to measure hormone levels. This testing can exclude possible causes of menstrual abnormalities or androgen excess that mimics PCOS. You might have additional blood testing to measure glucose tolerance and fasting cholesterol and triglyceride levels. We may also order an ultrasound. In this, we check the appearance of your ovaries and the thickness of the lining of your uterus. A wand-like device, which is known as transducer, is placed in your vagina, that is a transvaginal ultrasound. The transducer emits sound waves that are translated into images on a computer screen. If you have a diagnosis of PCOS, your doctor might recommend additional tests for complications. These tests include periodic checks of blood pressure, glucose tolerance, and cholesterol and triglyceride levels, screening for depression and anxiety, screening for obstructive sleep apnea. Now coming to the treatment. PCOS treatment focuses on managing your individual concerns such as infertility, hirsutism, acne, or obesity. Specific treatment might involve lifestyle changes or medication. Lifestyle changes, first I should tell you. We may recommend weight loss through a low-calorie diet combined with moderate exercise activities. Even a modest reduction in your weight, for example, losing 5% of your body weight, might improve your condition. Losing weight may also increase the effectiveness of medication of your doctor recommends for PCOS. I mean, if you lose your weight, then the medicine which we recommend in this condition have more good therapeutic effect. Okay. And these medicine can help with infertility. Now coming to the medication, we divide the medication in three categories. I mean, the first category is to regulate your menstrual cycle. The second category of medicine is to help you ovulate, and third category of medicine is to reduce the symptoms of excessive hair growth. Okay. So let me tell you about the first category. I mean, for regulation of menstrual cycle, we recommend combination birth control pills. These are the pills that contain estrogen and progesterone. They decrease the androgen production and regulate estrogen. Regulating your hormones can lower your risk of endometrial cancer and correct abnormal bleeding, excessive hair growth, and acne. Instead of pills, you might use a skin patch or vaginal ring that contains a combination of estrogen and progesterone. Then we can also give progestin therapy. Taking progestin for 10 to 14 days every 1 to 2 months can regulate your period and protect against endometrial cancer. Progestin therapy does not improve androgen levels and won't prevent pregnancy. The progestin only male pill or progestin containing intrauterine device is a better choice if you also wish to avoid pregnancy. And the second category of treatment is to help you ovulate. So now let me tell you about this. We might recommend clomiphene, that comes with the name of Clomid. This oral anti-estrogen medication is taken during the first part of your menstrual cycle. Then another medication is letrozole, which comes with the name of Femara. This is basically a breast cancer treatment which can also work to stimulate the ovaries. Then the third medicine, which is very important, is metformin, which comes with the name of glucophage. This oral medication for type 2 diabetes improves insulin resistance and lowers insulin levels. If you do not become pregnant using clomiphene, your doctor might recommend adding metformin. If you have pre-diabetes, metformin can also slow the progression to type 2 diabetes and help with weight loss. Gonadotropins. These hormone medications are given by injection, so they can also help in induction of ovulation. Now the third category of treatment is for to prevent excessive hair growth. Then in this case, we might recommend birth control pills. These pills decrease androgen production and can cause excessive. These pills decrease androgen production which causes excessive hair growth. Okay. Then another medicine is spironolactone, which comes with the name of aldactone. This medication blocks the effect of androgens on the skin. Spironolactone can cause birth defects, so effective contraception is required while taking this medication. It is not recommended if you are pregnant or planning to become pregnant. So this thing you should keep in mind. Okay. Another medicine is eflornithine, that comes with the name of Bonica. That's a cream basically, which can slow facial hair growth in women. Okay. Then there is a procedure which is known as electrolysis, which is in which a tiny needle is inserted into each hair follicle. The needle emits a pulse of electrical current to damage and eventually destroy the follicle. You might need multiple treatments for this excessive hair growth. Okay. I mean, you might need multiple sessions of electrolysis. Okay. Now, I should tell you about lifestyle and home remedies. To help decrease the effects of PCOS, you can try to maintain a healthy weight. Weight loss can reduce insulin and androgen levels and may restore ovulation. You should ask your doctor about a weight control program and meet regularly with a dietitian for help in reaching weight loss goals. Then you can limit carbohydrates. Low-fat, high carbohydrate diets might increase insulin levels. So you should ask your doctor about a low carbohydrate diet if you have PCOS. Okay. I mean, if you eat low-fat and high carbohydrate, then they increase insulin levels. So in order to prevent that, you should ask your doctor about a low carbohydrate diet if you have a polycystic ovary syndrome. You can choose complex carbohydrates which raise your blood sugar levels more slowly. Be active. Exercise helps lower blood sugar levels if you have polycystic ovary syndrome. Increasing your daily activity and participating in regular exercise program may treat or even prevent insulin resistance and help you keep your weight under control and avoid developing diabetes.